That, oh, that's Kim. Sorry. I called Kim Special to tell her that when I opened both of these trays and unwrapped them, the cap was off. Good. Well, of course it's right, but some folks forget. But it's interesting because I was a random person. We picked 2 probes at random, and they were good. So I wanted to give you the feedback that it was good. Okay? All right. So that's the probe you've been using or seen before.
If you're not, just
that
put
they
it
use
on
for
the
the
bottom.
prostate implant.
I still got an edge.
All right. That's for the ultrasound machines that they've had. Well, they got a new ultrasound machine, and it does surgery probes now. The surgery probes won't work on the other machine. So they went to surgery, they got a new machine. Well, there's new probes. There's a laparoscopic probe, which is like a probe at the tip on a stick that goes down into the trocar for laparoscopic surgery. There's another probe like that one. There's this one. That's for open surgery. So when the patient is open, they put this inside and they can scan by hand inside. There's also a robot probe that drops in to the trocar. So remember that lab probe that says on a stick? Well, the very tip is the probe. Well, it's the same probe for the robot, except it's on a cord instead of a stick. So you push it down into the trocar, comes out the end, and the probe grasp that they use for the robot, they'll grab it with that, and the surgeon can move it around while he's looking in. He can see the ultrasound inside. It's pretty cool. So, just so you know, I spoke to almost 20 people today, which is a miracle, in the OR. Catch as catch can, okay? Some, come by. The point is, I told them, I'm going to tell you, aside from switching this cap, aside from switching it for a leak test, because we have a leak tester now, I'll do that in a moment. I told the folks upstairs that cap does not come off of the probe unless it goes into the steroid tray before processing, or when they plug it into the machine. Any other time, I told them it's got to have a cap on. And that is, for those that saw me last time, I said, no, you don't touch that. Can't touch it. I love that. Okay, I love that. He's doing commercials now, right? You see him? Yeah, he's hilarious. Yes, he is, isn't he? But this green part here cannot be contaminated. Now, only for you. God help us. But if this gets something on it, you see it, you go, ah! Ah! Okay? I want you, do you have purple top Santa Claus?
Purple top Santa
Purple
Claus.
top? Yeah, purple top.
No.
What do you got?
We got Oxavir wipes.
No.
We don't have any Santa Claus.
And Oxavir on the probes.
We don't have Santa
Well,
wipe.
if you were going to use a wipe, what would you wipe that with?
Just like a sponge. We use sponges back there.
No. Nothing wet. It would
Okay.
have to be like moist. You know what I mean? Like a tissue or, you know what I'm talking about, a wipe? Because it's not wet, it's moist. But it's like this. Only if you think it's contaminated. God help me. Okay? But here's, carefully, only on the grain. Only on the grain, never here. Never here. Okay? Never here. Because if dust or whatever, lint or whatever gets in there, it can make a problem with the ultrasound machine, okay? Now,
Turn over help to OR 12, please. Turn over help to OR 12.
we got the cap off. You see the little thing it's connected with? I don't know if you can see, but there's a little slot right here. See the slot? I can take this
Hold
out.
it. Zoom. I'm gonna say zoom in. Do this.
This
so I can help her.
has to
Okay.
be off before you do a leak test, okay? Sorry. Okay. Yep. This has to be off. This cannot be put in water. Okay, so we set that aside. Right here. Is a chart for critical probes. The surgical probes that you got, they're critical. They get leak tested every time. Okay? That other probe there for the implants, that's called semi-critical. That only needs to be tested at least once every 3 months. You can test it once a week. You can test it after every use, whatever you wish, but no less frequent than once every 3 months. Okay.
Coming out here.
More frequent, fine. Okay.
Coming
Now,
out here. And then sliding
just to draw your
tip.
attention again,
Tap on it.
right here, can you see where my finger is right here? It's got a little picture of the leak tester. And, sorry, can you see this right here? That's the cap that I took off. See it? It's right there. Okay? Can you see it? Can you see it? Okay? So, it's even telling you what you gotta do here. It's gonna tell you to pump it to 150. I'm just pointing here, I'll show you. Make sure it doesn't leak here before you put the probe in the water. Because if it leaks and you see it leak, don't put it in the water. Because water can get in from wherever it's leaking, right? So if no water gets in, it's probably repairable.
So just like the endoscopes, you do a dry and a wet leak test, you do a dry and a wet for these ultrasonic probes as well.
Right, so all you're doing is you're making sure that needle doesn't do this. Okay? Because if it does that, you put it aside, you red tag it, whatever you do, and you say somebody's got to call BK Service to fix the probe, and we have to exchange it for a new one with money or whatever, you know, say, unless it's in warranty, of course. Anyway, so you put it in water, check for leaks. I think it's like 30 seconds, 40 seconds. Then you take it out, you dry it off just a little bit so it's not drippy. Then you can release the pressure on the bulb. I'll show you. Okay? Then you're going to take off the leak test cap and put the other cap back on. Put the cap on, clean it. Remember, you're going to leak test before you clean it. Before you clean it, it can't go in water with a leak. You know. Okay? Also, on the bottom here, if we're going to put this in the probe into a gas environment, which Stered is, right here, see, cap off and gas, Stered. If you were going to put it in liquid to clean it or wash or whatever, cap on. Anything liquid, cap on. Gas, cap off. And like I said, both of those caps were off, and I was happy because everybody here was good. Okay? All right. So here we go. We already took that cap off, and I'm going to come behind you. All right. So we're going to put the leak test. You see, we put it together. The tubing connects right here. You lock it onto the lower connector. Okay. And then it connects to the top of the bulb here. So we're going to put this on. Now, you probably, if you've handled it before, you see these little levers here? They have to be straight, and then it goes on easy. So it goes right on. Lock it real quick, quarter turn, it's locked. Now, the lever thing here has got it's got a lever. If it's locked, it's this way. You press this to release. See? So you press here to make sure it's locked or closed, then you can pump it. When you're finished testing, you press it here to release the pressure and then take the cap off. So I'm gonna close this. We're gonna pump it to 150. All right, now we're just gonna look at it real briefly to make sure the needle is not going down, remember? If you see it while you're watching for 10 seconds and it starts doing this, you know it's leaking, but if it, watch, I'll show you. You'll love this. Watch, I don't know if you can see it, but watch the needle. See that? It ain't going up, is it? Okay, I call that a catastrophic leak. That means there's a hole somewhere. Please God, don't put it in the water. Okay? Because it's going to go all over the place. And if water gets in the probe, it is not repairable. It is not repairable. Also, I just happen to think, remember that laparoscopic probe I said, a big long probe on a stick? That one is very, very, very sensitive if you leave the cap on. That one has a little a flex thing at the tip like this. Well, wherever this is, there's like a little, like a little plastic or rubberized little seal around that so it can flex. I wish I had a picture I could show you. If the cap was on that one and you put in Sterad, remember, the first is pressure. The pressure, remember, this is waterproof. It's not gas proof. So the pressure goes up, it goes inside and pressurizes the probe, the plug, the cord, and the probe. But later, there's negative pressure. And all of the stuff comes out. It doesn't come out here. So that thing, it flexes, when it's straight, it's like this. When it pressurizes, it does this. See it? It's just tight. Huh? When the negative pressure comes, this goes whoop, boom, and bursts. And it looks like somebody took a razor blade and went and cut it up because there's metal that shows inside. When you see that, you're going to take a deep breath and go, oh God. Okay? Because they're going to see it upstairs and they're going to say, what the hell? Okay? And then they're going to say, what did they do now? You know how it goes, right? You know how it goes. Anyway, so that probe is no longer useful. If it goes into water like that, that probe costs $25,000. Not repairable. So if you, like I said, you don't see it, you don't see it, okay, and you go to, and it does this, say, wow, something's wrong. Then you're going to look and say, uh-oh, put it aside, don't put it in the water. Don't put it in the water to finish the test because you can't, right? See? All right, so we get all done, we release the pressure. Remember, take it out of the water just to dry it off a little bit so it's not drippy. Release the pressure. Then you'll take off the cap. Again, not drippy because we don't want that to get wet. Then we're going to put this back on. So how do you do that, Jared? Watch, I'm just going to hold this on one side with my thumb. And I'm going to stretch it and push it through the slot. Okay? Hold it on one side, stretch it across through the slot, you're good to go. You've already tested, it's good. Put this on. Remember, they have to be straight. Lock it. Enzyme cleaner, detergent, whatever you're doing, do your thing, you rinse it, you dry it. I might have asked this before. Do you have a drying cabinet?
We do.
Do not put the probes in the drying cabinet. Why is that, Jerry? Because the probe is approved to 140 degrees.
If you in prep and packing, you seen the leak test part, you can go back and start packing, please. Deacon Tam, you need further education, stay out.
So, where was I? Sorry.
The probe. Don't.
Don't put it in the blanket warmer. I mean, the warmer.
Yeah. See?
I said
It
blanket.
brought me back. Because the probe is approved for 140 degrees thereabouts, but the had a customer not too far from here
Make sure you sign the sign-in list.
who figured, oh, we'll put it in the cabinet. Well, after a few times in the drying cabinet, that probe didn't work no more. Okay? So they called me, say, hey, what's wrong with that probe? I said, what have you been doing to it? Oh, we did blah, 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 blah. We put it in drying cabinet. What's the temperature of the drying cabinet? 180. Oops. So there you go. And they said, oh, well, nobody told us. Well, now I'm telling everybody. That only happened once. Okay, so I remembered that. I'm trying to make everybody not do the same thing. All right? So, are there any questions? Anything about the probes?
Now's the time to ask, guys.
Right, because they're going to be a little different than just that one here. Okay? But everything you do with this one, you'll do with this one. Or these, because there's 6 of them now. Two of these, the open probes, 2 of the or T probe, whatever you want to call it, 2 of the laparoscopics, and 2 of the probe for the robots. Okay, so that's 6 new probes. Only because they can have one that you are processing, that they can use another one for another case if they need to right away. Okay, so everybody cool? Uh-oh, there's always one.
Come on, Hawaii. I love it. Give it to him,
I'm
Hawaii.
kidding with you. Yes, ma'am. What can I do for you?
So, all of them tested the same, the leak test, are they all tested the same way?
Yes, because it's the probe. All the probes have the same plug, just like this one, same plug. Except you didn't have a leak tester before, correct?
We did.
You didn't. Well, now you
We
do.
do now.
And this came with the. It was ordered with the new ultrasound machine. So now you got one. Then this, I told Kim, I mentioned before, this one does not need to be checked each time. You can if you want. However often they use it, you know what I mean, okay? But no less frequent than once every 3 months. I got a lady in who's the manager in sterile processing in Richmond, Virginia, and she said, I'm going to put that, whatever the date, how often I want to do it, I'm going to put it on my calendar so I'll get an alert. And she knows the time to go test that one. Because I think she wanted to do it every month or something. You know what I mean? So, whatever you want to do, however you want to work it, it could be every time that gets used. Let's say they use it,
So
I don't know,
Kim, would that be a
6
form?
times a month. You have
Would that
to-
be a form
Take
to
6
confirm that the testing was done?
You don't have to, okay? Also, remember I told you that other probe will blow up and shred? I had a customer
Okay.
at a big outfit, not too far from here. See these buttons are on the probe? I know you've seen them. They did the leak test. They pumped it up, popped right out. Now, there's probably something wrong with the button being glued in, you know, but it popped out. So, they had to work out something to get a new probe, you know what I mean. But the idea is, remember, don't drop the probes on the floor. The robot probe, $25,000. The laparoscopic probe, $25,000. Why? Because they're special probes. Okay? They're special. This one here, I think is 18. Something like that. Okay? So they're not $500 probes. They're not easily replaced. So please treat them kindly. Don't drop them on the floor. And if you do, say, I didn't do that. Who did that? I don't know. I got a good story for you, real quick. Had a customer, wait a minute. They put their probe in water. Well, there was a little port in it. Well, they put a cleaning thing in it. I told them not to. They had that probe for like 2 or 3 years. All of a sudden, it said something's wrong. So I went there to go visit. And I picked up the probe and I went, it had water inside. Because they put a brush inside. And there's a little tiny piece of tubing that they disconnected and water got in when they cleaned it. Okay? So I'm just saying that stuff happens, but you gotta do as best you can to avoid things from damaging the probe. Okay?
Just one more thing I wanted to add. Go ahead, Hawaii.
Okay, so I know in scope there are times that the tester itself is broken. With this situation, how would you know if the tester is broken?
When you put
By
it,
not this-
when you connect it and you put it in the water, remember it's pressurized,
Right.
and there'll be bubbles come out from something. So if something was cracked or broken, now, I'm gonna tell you right now, if that cap for the leak tester is cracked and water gets in that, the probe is compromised because it's got back into that plug. Yes, sir.
So, so for some of the scopes, we have different testers with like Olympic or Pentax. Is this the similar situation where you might have different companies that we have to use?
Well, no, but all the probes you have, all have the same plug,
Okay.
all have the same cap, all fit the same leak tester.
Gotcha.
Okay, so that won't be an issue. And just to remember, these caps come off when they go in stereo. I know there's some things you gotta have that blow when you put in stereo. These have to be off where the probes can be damaged.
To
Okay.
reiterate what Hawaii was saying, he also mentioned that if you're ever testing and you see water coming from here
Bubbles.
or bubbles,
Yeah.
it could be the a faulty end cap from your leak tester. So this will be the leak tester process for your BK ultrasounds, period. There's no other vendor. All right. So what he said was as soon as he switched where he heard or saw bubbles coming from, and it'll be from right here. Is that right, Mr. Jerry?
Yeah, well, it did that time. I had a customer I was talking about it. Well, let's go do it. So we took their probe, brand new leak tester. Well, I put it on, we pumped it up, looks good, put it in the water. Oh my God, there's bubbles coming out. What? Well, the bubbles were coming out of this piece right here in the cap. So it turns out it was just a faulty cap. So they replaced the cap, everything worked fine. See what I mean? Because I mean, my eyes like popped out. What? No, I see bubbles. Where? All right. Okay.
That's it, guys. We got